Assalamu alaikum, my dear audience. Our today's podcast topic is dengue disease. I am welcoming my chief guest, doctor, nurse, and patient for giving me their precious time to discuss about the dengue. So let's start our today's podcast. My first question is from the dengue patient. How are your healthy conditions when you positive dengue?
When I was tested positive dengue, I had high fever 102 and high headache, nausea, vomiting, pain, fatigue.
Okay, good, thank you. Now we are moving towards the doctor. My first question from doctor is how you can diagnose and treat a dengue patient when it is coming in emergency department.
We diagnose a dengue by three methods. First is the physical examination, and second is the medical history, and third is the lab test. In first step, we examine and assess the body symptoms like the fever and headache and pain, and in the medical history, we check the previous report. And third is the lab test. In lab test, we see the rapid diagnosis test, which is give the result of the dengue, and other is the CBC, which takes us to the accurate number of the platelets. Sometimes dengue test comes negative, and platelets seems too low. Then we can idea that he suffering from the dengue, and we short treated the dead patient with the folic acid once a day, and we accommodate the. So we administer we administration the fluid regularly.
So that was our doctor's explanation on the dengue diagnosis and treatment. Last but not least, you all know that the nurse has a major role in the treating of the patient. So my first question from you, the nurse, what will be the nursing management on the treating a patient when it is admitted in hospital?
As a nurse, role includes closely monitoring the vital signs and fluid balance, and will be administering fluids as prescribed, providing pain relief medications, and educating the patient to take measures to prevent mosquito bite and to avoid future administration.
Okay, thank you. Now I am listening from you, Doctor.
Yes.
What will be the symptoms of an patient who has a dengue? How we can see that as like when he has a dengue?
The symptom of the dengue patient feel very high fever and pain in whole body, especially in the joints of the patient and behind the eye, and he not getting the relief from medicine such as we give whatever such as we can around and we usually give them a folder. Profile.
Thank you, Doctor, for brief explanation on the dengue disease, symptoms, diagnosis, and treatment. So, our last question from you, Leonard. How a nurse can educate a patient who is discharging from the hospital due to dengue?
Sure. As a nurse, I will be educating the dengue patient for staying hydrated and by drinking plenty of hot fluids and monitoring the warning signs such as severe abdominal pain, bleeding or persistent vomiting, and advising to avoid NSAIDs, the painkiller medicines such as aspirin or ibuprofen, such as these can increase the risk of bleeding.
Thank you, Doctor. Thank you, Nurse. Thank you, patient, for giving me a surprise discussion on the dengue patient. So, thank you, guys, my audience. Thank you. I am very thankful to my our guest who is giving me a precious time for discussion on the dengue disease. Thank you, audience, for listening us.